Okay. So are we still waiting for Dr. Gower?
If David gave him the right information, he should call in.
It's not yet. It's 1 minute before. So
Oh, we're a little early. Okay.
I just want to let you know there's more than 1 here.
What about Donna Swarsky?
Hello, who just joined?
This is Janet Major.
Hi, Janet.
You what happened to Janet?
Saw your email.
And I kept it named. Yeah, I didn't show up at the last 5 minutes of the meeting. It's kind of
I know she's close to 2 years about there, you guys.
yeah.
Trying to do the dog figures.
Yeah.
I haven't heard from her, so I don't know how she's doing.
I sent her an email.
Mike, this is Alan. I would suggest we start getting going, and
Okay.
if Dr. Gar joins us, that'll be fine.
Okay, let's do. Let's do a kind of a roll call. Eric, you want to start?
Yes, this is Eric. Eric Thomas, project manager on the Arizona Broadband Project. Eric Vanillotta, Chief Technology Officer for Meta.
Mike Golden, Broadband Development Manager, Director, Asset.
Ralph Garish, Arizona Telemedicine Council, Arizona Telecommunications and Information Council.
Bruce Bowers, VP of Business Development at Meta.
And on the phone,
Alan Pitt, physician representative, healthcare representative.
Ivan Sukanik with Cox Communications.
David Daniels from Cox Communications.
Major
And this is Pramod Kaur from United Health Group.
could you read? Oh, yes. Hi. Welcome, Dr. Gar.
Can you hear us okay, Dr. Gower?
Yes, thank you.
And is anyone else on the phone?
Janet was in the background. Okay.
Yeah, Janet Major. Janet, you there?
Yes, thank you. Janet Major here, Arizona Telemedicine Program.
Okay. Anyone else that we haven't heard from?
Deborah's on the line. I see her over here. She may not be on Janet.
And Deborah Dupay is on the iLink line. Good. Well, Alan, why don't you take it away?
Oh, thanks, Mike. Thank you very much. So I thought today a couple of things. First of all, Dr. Gar, thank you for joining, and Ralph Garish kind of briefed me a little bit about who you are, and we'd like to talk to you briefly. Just as